Alrighty, so I think let's go ahead and jump on into it. So just to introduce myself, for anyone who didn't catch the first webinar, my name is Jager Spratt, and I work with the Pulmonary Hypertension Association. I am the Advocacy and Treatment Access Project Manager here. So I will be mainly the one that you'll talk to if you have any treatment access questions and reach out to PHA about it. So happy to take questions now. You're also welcome to email me later. More than happy to provide support for folks looking for financial assistance and broad guidance on insurance. I can't necessarily tell you which specific plan to sign up for, but we will do our best to give you advice on your options. And yeah, just before we jump into things, I do want to give a shout out to Janssen Pharmaceuticals and thank them for their support of this webinar and other programs like it. Very happy that we're able to bring you all these kinds of resources. And with that, I will go ahead and turn it over to Danielle.
Wonderful. Thank you so much, Jager. I appreciate it. So welcome back. And for those that are joining us for the first time, welcome. Today we're going to be talking about Medicare and more of its ins and outs. I will also be sharing with you some tips along the way that us as providers and staff would like you to know. So for today's goals, we're going to dig into trickier details of Medicare plans. We're going to review options for affording PH medications with Medicare coverage. And we're also just going to try to find out what your care team wishes you knew. Last week, we spoke about the basics of Medicare plans. This week, as we get into the details, I want to start off talking to you about different Medicare plan options. So to start with, I wanted to talk more with you about the Medicare Advantage plans and how they differ from Medigap plans, which was brought up a lot last week. Medicare Advantage, like we talked about last week, combines Parts A and Part B from original Medicare, plus sometimes includes a Part D plan for prescription drug coverage. This is provided by private insurance companies, but it is still considered a Medicare plan, not a commercial plan. Because the plan is provided by a private insurance company, it uses that company's network, so their network of doctors or facilities. So be sure to check whether your doctors and care facilities will be in network before signing up for a particular Advantage plan. Also, please take note of whether the plan requires a referral before it will cover a specialist doctor visit. Your out-of-pocket costs vary with some Advantage plans. Some may have a lower out-of-pocket cost for certain services, while others may be higher. You pay the monthly B premium, and you may also have to pay the plan's premium. Some plans may have a $0 premium and may help pay for all or part of your Part B premium. Most plans include Medicare drug coverage, which is Part D. Again, it is important to read the fine print and understand what your cost-sharing responsibilities will be with a particular Advantage plan before enrolling. Now, I want to dig into Medicare supplement insurance or Medigap plans, sometimes also called Part D. Medigap is a supplement insurance that helps fill gaps in original Medicare. It is also sold by private companies. However, this still does not qualify as a commercial plan. You are still considered a Medicare beneficiary. Again, however, since the core insurance coverage is coming directly from your original Medicare with Parts A and B, you have Medicare's network when looking for in-network providers. In most cases, you won't need a referral to see a specialist provider. So if you have Medicare and you know all of your doctors are going to be all of your doctors are currently in Medicare, when you look for a Medigap one, you can almost guarantee that your doctors will be in network for them. For Part B covered services, you usually pay a 20% coinsurance on the Medicare approved amount of that service after you meet your deductible. Of course, after you meet your deductible, because that's a big thing. You always have to meet your deductible before you start paying a 20% coinsurance. A Medigap policy can help pay some of these remaining health costs, like your deductible copayments or co-insurance. If you get Medigap, there is a monthly premium in addition to the monthly premium that you're going to pay for Part B. And if you enroll in a Part D plan, you will have a third premium payment for that plan as well. So yes, Medigap does cover similar items as the Medicare Advantage plan. However, I want you to know that it does not cover some of these other things. The Part B deductible. So if you already have Medicare and you've had it since January 1st of 2020, you might say, oh, but it does cover my Part D deductible. That's great for the people that have joined before January 1st of 2020. After January of 2020, it no longer covers the Part D deductible. It will not cover the long-term care, like your non-skilled care you get in a nursing home, your vision or dental services, your eyeglasses, or any private duty nursing. So that's what Medigap will not pay for that Medicare Advantage plans do sometimes cover. So to summarize Medicare Advantage versus Medigap, Medicare Advantage uses the network of the private insurance company your plan is going through, while Medigap is a supplement, so you are still using original Medicare networks for your provider. Some Advantage plans require a referral for specialists. Be sure to check. Medigap will not require a referral if original Medicare also would not have required one, which generally it does not. Each Advantage plan will have different out-of-pocket costs for deductibles, copayments, and coinsurances for different services. You'll need to check that the types of services you'll need are covered at a rate you can afford. Original Medicare typically charges a 20% coinsurance for Part B covered services, and the Medigap plan helps cover that cost. Regardless of what plan you choose, you are still going to be responsible for the Part B premium. With Advantage plans, you still have to pay another premium, although some plans have a $0 premium and offer help with Part B premium coverage. Medigap plans also come with a premium cost, and you'll also owe a Part D premium cost for your prescription drug coverage. So as you can see, there are some advantages and disadvantages to both plans. You just have to really look and see which ones you want to do. And the great thing is this slide explains a lot of it, so you can kind of go back and look at it because it's a lot of information. So what do I need to look for when I pick a Medicare Advantage plan or Medicare Part D plan? You want to check the network in your area. You want to know how many of your doctors take Medicare. How many would be in network for any Advantage plan you are considering? And you also want to know what are your out-of-pocket costs that you'll owe. Is there any assistance with premiums offered by the Advantage plan you're considering? Does your Advantage plan come with prescription drug coverage? And if yes, are your PH drugs on formulary, which we talked about last week? Please know that even if the drug is on formulary, your doctor's office will still need to do a prior authorization for your medication. This is the only way the insurance company will pay for any part of your medication. And then there's one very important note that we want to make when considering a Medigap plan. There is one very crucial golden window of opportunity where you can save on the cost of that plan, and it only happens once. Once you turn 65 on the first day of that month that you are enrolled in Part B of Original Medicare, that starts the beginning of the 6-month period where your acceptance into the plan is guaranteed, and the plan can't charge more if you have a health condition. So if you apply for Medigap coverage after your open enrollment period has passed, you may have to go through medical underwriting where the insurer reviews your medical history to determine if they will provide coverage, what premium to charge, and whether to impose a waiting period before coverage starts. Now, there are a few states that have various state-specific rules around additional exception periods to the underwriting requirement. And those states are California, Oregon, Idaho, Illinois, Louisiana, and Nevada. Also in Washington, they allow supplement eligibility all year, but this also means rates for supplement Medicare plans in Washington are higher. So really, you just probably want to check with your state to see whether or not there are any additional exceptions to that 6-month period. So it's very important to know that if you are going to choose Medigap, if you decide you want to go with there, you have that 6-month period from the time you turn 65, and after that, they may say that your PH is a existing condition and they may not want to cover you. So you definitely want to make sure that you're looking into that ahead of time. And then one final note for this section alone is I wanted to touch base really quickly on drug tiers. What are drug tiers and what are most of the, and where do they land? So tiers are the level of cost sharing for each medication, and each plan differs. But an example of how they may be set up is a 4-tier system where tier 1 is for most generic prescription drugs and requires the lowest copayment, up to tier 4 for the high-cost prescription drugs requiring the highest copayments. And as many of us know, most PH drugs will fall into the tier 4 category. So expect that your copayment is going to be the highest. So now we're just going to take a quick pause, go back, see if there's any questions that anybody has about what we just spoke about. So Jagger, I'm going to push it over to you and see, do we have any questions that some people had about the dreaded Medicare Advantage versus Medigap?
Yes, so we've got just a couple of questions, and folks feel free to type in some more questions while we're having this little bit of a pause. So one thing not quite directly related to Medicare or Medigap Advantage stuff, Jane is asking, or she says she does not see Tyvaso DPI on Medicare website, and she's wondering how to sign up for that.
Okay, so what I can tell you, Jane, is that with the Tyvaso DPI, it is not going to be under Part B any longer. It's now covered under your Part D. I have patients that are on Tyvaso DPI and it does go through their Part D, so it is on formulary. What Medicare as of right now has not necessarily, they have the old Tyvaso on it, but I've had people get it through their Part D or for their prescription plans, so it should not be an issue. It goes through rather quickly. They will probably list it next year because it is in the middle of the year that it was launched. So if you are going to be going with the Tyvaso DPI, just know that it's going to go through your prescription benefits and not your Part B. We talked about this a little bit last week also, but just so you know, if it's the DPI, which is the dry powder inhalation, it is going to go through your Part D prescription. And yes, Medicare will cover it.
Right,
I hope that answers your question, Jane.
Yeah, do let us know if you have some other questions.
Yeah, absolutely.
And there was a question from Lav. I had typed in a response, but Lav was asking, so currently Lav is below 65 years old and has Medigap,
Okay.
and wanting to know if she changes the Medigap provider, like how to do that without medical review and when to change. So I would assume, I think based on what we were talking about, that Lav, once you turn 65, then you will have that period where you don't have to get any underwriting. They won't be reviewing your medical records. So you would want to wait until you hit 65, since you already have Medicare, I assume, with your Medigap. And then at that point, you can reapply for potentially a different Medigap policy. And then that would be when you would not have to deal with the underwriting and could potentially be getting a cheaper rate at that time.
Yeah, agreed. Agreed with that.
And then there's a couple of other questions here. So Beth is asking, if you're going to remain on a spouse's insurance from an employer even after he retires, do you need Plan D and Advantage as well? She's saying that she has the retiree benefit at his employer.
You don't necessarily need to. It's really, I mean, it is exactly what it says it is. It's a supplement insurance. Both of them are both supplement insurance. Medicare's, if you have a main commercial or a retiree plan, Medicare is just going to help with whatever your main insurance is it won't cover. So it might be something that you might want to look into to see if you know that your copays are going to be rather high and you want assistance with that, since you're not going to use them for your initial part of it, it can help you with some of your copayments, some of your deductibles, things like that. So I think for you, it would be really just a matter of looking at what the cost would be and whether the cost of the premium for an Advantage plan or a Part D plan would be less than what it might be if you don't have it at all, depending on what your copayments and what your deductibles are going to be if your husband retires and you could stay on that insurance.
All right,
It's really just, that's a more individual question, but I think that is the best way to say it, because Medicare is always going to pay last. You know, if you have another insurance, they're going to pay first, then Medicare will come in second.
okay. And then Lav has a follow-up question or response. So she's saying she's single and on Medicare and under 65. She's asking if she gets married, can she use her spouse's insurance and withdraw from Medicare? And if yes, when she re-enrolls to Medicare and has Medigap again, you know, maybe when she's 65, will she have that underwriting waive period?
I believe so. I believe that it's just that 65 is kind of like where they, you know, that's when anybody can get the Medicare, right? So I feel like, yes, if she gets married and she drops the Medicare, she goes with her spouse's insurance, then when she turns 65 and she goes back to it, then she has that 6-month period. But after, I don't think that she'll have any issues having to go through an underwriter as long as it's within the 6 months from the time she turns 65.
Yep. Yeah, that makes sense. I think that sounds right to me as well.
Yeah.
Okay, and then Jane had a follow-up question about the Tyvaso DPI.
Mm-hmm.
She's wondering about how to compare plans if Tyvaso DPI is not on the website. She's wondering if she would have to contact each individual insurance company.
Probably, Jane. Unfortunately, I'm sorry. That is like the shortest version of it. Is that yes, you would probably have to contact them, and again, it's going to depend on. It's going to be a tier 4. It's going to be the highest copayment. So I really feel that if it's under the Advantage plan, you might need to know what their co-insurance is going to be. Most of them are 25%, so it's really just going to be what the insurance company is willing to pay for it, what they will pay, and then it's usually going to be 25% of whatever the cost of the medication is going to be. So you might want to check with them. That's what I would probably do. Unfortunately, we cannot do any type of benefit investigation unless the doctor's office cannot, unless we know that you're definitely going on it. And then we don't really even know until the specialty pharmacy does a benefit investigation. So I can't really say. I'm sorry. I wish I could give you more, but I guess the best thing for you would be to go to each individual plan and see what they have, or if possibly they have it. Well, no, because it goes through Part B, so that's not right. No, you would have to definitely call them and see what their Part D plan pays. What percentage do they pay, and do they know anything about the Tyvaso DPI?
All right, and then we have a question from Miriam asking, how does Medigap work with disabled people? Which is a very good question. I personally am not 100% clear on that intersection of like age qualification for Medicare versus when Medicare is coming through the disability benefits.
Disability benefits, yeah. I'm not sure that there's the 6-month period for those people because they are disabled. They're, you know, they have that. I don't want to say label, that's the wrong word I'm looking for, but because they've been able to get the insurance through their disability insurance as opposed to turning 65, I'm not really sure, and I definitely want to do some research on that. So what was her name? Miriam?
Miriam.
I'm going to have Jacob write that down for me, and I will look into it for you, and we can either address it next week if you're going to be there, and if not, you know, if you want to send a private email to us, we can definitely get that information to you, because I'm really not sure about whether or not, I'm assuming you want to make sure that you get the Medigap before you have to do an underwriter. So if that's the case, just give us some information and let me know. And I will definitely, if you can't be here next week, I will definitely get that information to you.
Yeah.
Because I don't know.
Yeah, and we are for sure going to be including a like the frequently asked questions document and just sending that out to every single person who's registered for these webinars. So we will also have those like written answers for everyone as well. So Miriam, if you're not able to join us for the next one, we will definitely get you those answers still.
Oh, awesome. Okay, thank you.
Okay, so I think at this point, let's go ahead and move along. We do have a couple other questions, so we'll get to them at the next section break.
Sounds perfect. All right, great. So in this next section, we're going to get into one of the biggest questions that causes the most stress for patients and for your care team too, let me tell you. How am I going to pay for all of this? There are a few different things to consider when figuring out how to pay for your treatments. One of the biggest challenges for Medicare recipients is affording their insurance. In affording their insurance is the dreaded donut hole. So the donut hole, what is this? This is a temporary limit on what the drug plan will cover for drugs. In 2022, the total is $4,430. The limit will be $4,660 in 2023. And this amount may change each year. Once you reach this amount, you officially go into the donut hole, which means that Medicare will no longer pay for any part of your medication until you reach catastrophic coverage limit. So a lot of people say, well, what is the percentage of the amount I will have to pay when I reach this donut hole? So whether it's Medigap or Medicare Advantage, you want to look for a plan that will ask you to pay 25% of the cost of your prescription. This is the best you're going to be able to expect from most insurance companies. And how do I get out of the donut hole? You get out of the donut hole when you hit the catastrophic coverage limit. You might hear sometimes people say, well, I hit catastrophic, so now I'm not in the donut hole anymore. So for 2022, the limit is currently $7,050. Once you hit that limit, you are then asked to pay either 5% or a small copay, whichever is greater, of the cost of your medication for the rest of that year. Insurance companies will pick up the rest. Now, again, 2023 means you will go back to zero, and then you're going to have to go to your catastrophic again or to your limit to go back into the donut hole. And another question I get a lot of times is, well, can I avoid going into the donut hole? And the simple answer to that is no, you cannot. However, there are certain people with low incomes and limited assets that may qualify for the low income subsidiary called Extra Help for Part D. If you qualify, then Medicare will waive the gap for you. And also your ordinary copays on your prescriptions will decrease quite a bit with this service. You can apply for the subsidiary at your local Social Security office or online at their website. Now, if you have Medicare, but you don't qualify for the low-income Extra Help for Part D, there are options out there for you. Sometimes it's hard to find them, but you have to be persistent. You can turn to nonprofit grants or funds, manufacturer programs, and even your specialty pharmacy. So the question, I have Medicare, but I don't qualify for the low-income Extra Help for Part D. What can I do? Well, like I said, there are options out there. There are grants. There are several grants available for pulmonary hypertension. The Health Well Foundation, now this foundation is particularly only for Medicare patients. If you do not have Medicare, you cannot apply at Health Well Foundation. Another one is the Assistance Fund, the PAN Foundation, and Patient Advocation Foundation. Those are four of the main ones for grants. And of course, you could always go to the PHA website, phassociation.org, where they have the information listed with what grants are open or closed, or those that have a wait list available. So it's a one-stop shop. You can go in and see who's open, who's not, and if somebody does have a wait list available. So that's a great tool for you to have. Now, manufacturers. I know people are thinking, what? Manufacturers have a program? Yes, they do. Most manufacturers that have name brand only medication, meaning there's no generic available, yet have what is called a PAP program, Patient Assistance Program. This is typically only for people with commercial insurance, like through their employer. However, Medicare patients can sometimes get assistance, but you must meet certain requirements. There must be no grants available at the time of application. Your application must be filled out in a timely manner, along with all the financial information they require being sent and documented. And thirdly, your doctor's office will need to fill out part of the application. However, you do not need to send both together. If you have sent in your financial information and the doctor hasn't sent theirs yet, they can always send it separately, and then as long as your information is on there, they will get it and they will put it together. So don't think you have to wait for your doctor's office to get the information to them, or sometimes the doctor's office will send it before your information is there, and that's fine as long as it comes together. So you will get it if you fill out the application properly. And then there's also specialty pharmacies. Some specialty pharmacies will not let you know that they also have a patient assistance program, or PAP, but it must be a complete last resort, meaning there's no grants available, there's no manufacturer PAP program available, or you were denied by the manufacturer program. And what you must say is that you cannot afford the medication copay, and you have tried every other option to get funding, but have been unsuccessful, and you would like to know if they have a patient assistance program available through them. Not all specialty pharmacies have them, but some do. So you just need to know and need to ask. That is the most important question, is to ask. The worst thing they can say to you is, no, we don't have it. I want you to remember this when you're managing your financial assistance. These are some of these tips that I want to talk to you about. I want you to keep tabs on your grant funding if you have one. Keep records of what company you are getting your grant from. I can't tell you how many times a doctor will come back to me and say, my patient has a grant, but they don't know where it's from. You must know where your grant is coming from. If somebody else helped you do it, that's fine. Just make sure you know the name of the grant. So this way, when you go back to your care team, they can go to that grant and find out the information that you are needing. At the end of the calendar year, you must start calling for a new grant. All grants are for 1 calendar year. It does not roll over if there's money left. Some of the foundations have grants available on a rolling basis, so you cannot reapply for 12 months after receiving the grant, rather than resetting in January. And you must do this by yourself, by calling or going online to do it again. You must be the one who initiates another year of funding. If someone helped you do it last year, reach out to them again and see if they're able to help. Now, not all grants last for a full year. Please make sure that you are aware of how much is left, so you do not get a surprise bill from your specialty pharmacy saying you owe because your grant ran out. Another tip is to make sure when you speak with the specialty pharmacy customer service rep that your grant is still taking care of your copayment, so you're not shocked by a big bill. And it is their responsibility to let you know that your grant has run out, the specialty pharmacy's responsibility, but that doesn't always happen, so you want to make sure you're keeping tabs on it yourself. Very important. And again, we're just going to take a quick pause, go over some more questions. And Jada, you said there was some more reports, so I'm sure assuming now at this point we have a video.
And Danielle, right there at when you said we were going to take questions, your sound did kind of like get fuzzy, just as an FYI. Hopefully it'll fix itself again.
Okay, I'm going to try to get a little bit close.
Yeah, that was perfect. So I think that might just be the distance
You're really close, sorry, just a floating head.
Okay, so let's see. We'll start with something. I think Sarah might have shared one of the questions that was sent to us during registration. So this person is asking, I'm in need of copay assistance for Uptravi and Opsumit. My insurance choices on Medicare are limited by my former employer's choices. Most choices don't even cover Uptravi, and the ones that do limit my access to other meds that I take.
Okay. Okay. So manufacturers do have PAP available, again, as I said. So if it's a matter of your doctor feeling that Uptravi and Opsumit are what you need to have, there are options available through the manufacturer. If there are no grants available, which this time I don't think anything is available.
Correct.
Then what you want to do is get in touch with the manufacturer of those drugs and reach out to them. Your care team should have that information for you, or you can Google Uptravi Opsumit and look up for Google Uptravi and Opsumit patient assistance program, and something should pop up for you. And you can reach out to them and ask those questions as to saying, there's no grants available, my insurance is limiting what I can take, my doctor wants me to be on this medication, what can I do, what can you do to assist me? And they should be able to give you some assistance at this time. So just because insurance is saying no doesn't mean that you're going to not be able to get it. There are other ways, so please take those tips and hopefully you can find something. But I would check with my care team first and see if they can give you the phone number to where you can go for the manufacturer to get the assistance from PAP, Patient Assistance Program.
All right, great. Oh, and before we get into more questions, Lav, I wanted to follow up on your question about the FAQ document. So Lav was asking they hadn't received the PDF from previous 2 meetings. That is correct. So we haven't sent anything out yet. I know we do have, I believe that the first 2 recordings up online. And Sarah, if you're able to share the web address, I believe we had said it was going to be on a particular website and then it might have showed up on a different page on our website. So if we could get an updated link for that to check out the recordings, that is available. That FAQ document will not go out till the very end of this series, just so that we can get all the questions lumped into one document and just send that out as a single piece for people to look over. So for the next question, let's see, Carla is asking, so Carla is 70. She's had Medigap for 10 years. She's asking if she changed to Advantage and found that it didn't work for her, could she go back to Medigap and or are there penalties?
Excuse me, I'm so sorry, Carla. Excuse me, everybody. We looked into that a little bit, and I think it's just the underwriting again, where you may be exposed to an underwriting, excuse me, we might be exposed to an underwriting where you might have to either have a waiting period before they will do it, or you might have to pay a little bit of a higher of a premium. But there wasn't, so in the sense of a penalty, I think the only thing that might be a penalty is that your premium may be able to go up a little bit higher if you decide to go to a Medigap instead of the Medicare Advantage. I did not see anything, and Jager, I mean, I think that we talked about it, that we didn't see any type of penalty, but it was just more of like that there's a possibility that we might have a wait time, or that your premium might be a little bit higher and things like that. So
yeah.
I'm not really sure that necessarily you're going to get a one-time penalty. It might just be that because you are older and you passed that 65 guarantee that you have.
Yeah, that's my understanding. Like I said, we'll probably want to double check, but everything that I've seen suggested that there's not going to be a specific penalty for switching back and forth. Just the downside would be missing out on that window. So, and I do know it depends on the particular Medigap policy, but there is a chance that you could be outright denied for that particular policy if they do the underwriting process and find that you know, that basically that they don't want to take on the risk of someone with like a serious health condition.
Yeah.
Unfortunately, they do have that ability when it's outside of that open enrollment window for Medigap. So that's why that's especially important once you have that 6-month window to jump on it when you can, if you think that you do want to do Medigap. All right, and then for our next question, let's see. Okay, so we've got some more questions from Miriam. Miriam asks, will specialty pharmacies stop sending medication if coverage ended and you don't have a new insurance yet? Miriam says she's between jobs right now and may lose Medicaid until she finds a new job.
Ooh, okay. I can say that some of the larger, I know that some specialty pharmacies will work with you. If you're on a medication that if you are to go off of it without titrating down, could put you into the hospital. They will not, they will work with you. And you don't have to be without the medication. Some of the prostacyclins where you can't just go cold turkey. I know that some of these specialty pharmacies will work with you if you don't have insurance anymore. And again, Miriam, there are manufacturer programs and there are grants. If you lose your insurance, most manufacturers, if you are uninsured, will give you your patient assistance program. So please don't just think that you're going to be without. If you have lost your insurance, reach out to each manufacturer individually and let them know that you have lost your insurance and that you're on this medication and you would like to stay on that medication, and will they please assist you. Definitely do that the minute you know that, whether you're being laid off or you're changing jobs and you have a certain 30-day period or something like that, Miriam, please reach out to these manufacturers. Please let them know that you're without insurance at this time, and they will be able to help you for sure. The specialty pharmacies may, even if it's a generic drug, even if it's not a generic drug, there's still the manufacturers out there that made the original drug. So go to them. They might have a PAP program for the name brand drug again until you get insured. So please, please Google the names of the insurance company, of the manufacturers, or talk to your care team and let them know what's going on. They absolutely should be able to get you something while you're uninsured. Of course, once you're insured again, things will be different. You won't be getting free drug, but for the time period that you're not on insurance, you can definitely get something. The manufacturers will not allow you to go without drug if it's something, most of our drugs are life-sustaining. We don't want you to be off of it for long, because obviously you'll be hospitalized and that will be good. So please, Miriam, reach out to the manufacturers if you do wind up losing your insurance for a short period of time.
All right, thank you for that.
That scares me, sorry. I just get very upset.
Yeah.
I don't want anybody to be without medicine.
Okay, so we have someone also asking, does Medicare Advantage have an underwriting concern, or is it just Medigap? And as far as I understand, Medicare Advantage does not have underwriting, that it is specific to those supplemental Medigap policies.
Yes, I agree. They do not.
All right, and then let's see. So Jerry has a question about the donut hole. Jerry is asking, what is the income level where one is not eligible for the donut hole? So I think getting that exception. And then also a comment from Jerry that some companies are no longer extending grants to Medicare patients. Jerry says that includes Janssen. So two different separate things.
I actually have a response to the Janssen thing, and I'll talk to him about that. But unfortunately, I don't know what the limit is. I think it depends on. I think it's quite low, to be honest with you. The best thing for you to do would be to go to your Medicare.gov and look for the income threshold there. I think it depends on how many people are in your family or in your household at the time. They have different levels for if it's just yourself or yourself and a spouse, or if you have somebody that's in your family that you're helping I think that each of those incomes are, they take into account everybody's income. So if you have somebody living with you, if you have an older child that lives with you and brings in an income, they actually do take that into consideration also. So it's not always the easiest thing to get, but if you need a definite number, I would suggest going to medicare.gov and see, because I'm not sure if it's different for each state, because like we said in the other one, there were different ones for those California, Oregon,
Yeah.
and stuff like that. So I'm not really sure. Jigger, are you aware of if it's by state or if it's
I
by?
would expect it not to be. I think most things for Medicare are federally across the board. I think it's just the supplemental policies that maybe have some different state regulations of like expanding, like, you know, better kind of rights more or less, but that standard like limit would be for most states. We will definitely double check that and provide that information on that FAQ at the end of the series.
Yeah, for sure, because I'm curious to know myself now. And then you said something in specific about Janssen, and I just wanted to address that really quick. I'm not talking, I really don't want to talk about certain manufacturers and things like that, but I do know this. Janssen is changing their program a little bit, their PAP program, and I'm not going to say that it's not going to be covered, but changes are being made. So just in January, and things will be discussed, and every care team will know the difference in what's going to be happening. So don't think that Medicare, just because you're Medicare, means that you're going to be punished and you're not going to be able to get PAP, because there will still be some programs out there.
All right, awesome. And then another related comment about the donut hole. This person is saying, I've heard about the Medicare reform is going to downsize the donut hole. Do you have more information? Which I think that might be referring to the recently passed Inflation Reduction Act.
Yeah.
And then there's another question, I think kind of similarly, Joanne is saying, I have read that the 5% requirement after exceeding catastrophic level goes away in 2024.
Yes, I think they're definitely, I actually was just speaking to somebody today about that, and there are definitely going to be some, with the Affordable Care Act, there's going to be so many different changes that are going to be made. I heard that the donut hole is going to be only $2,000, and once you hit that, there will no longer be a donut hole in 2025. I don't know if that's reliable or not. I think at this point, we won't really know until everything truly comes out. But at this point, we can do as much research as we can, Jagger, you and I, and we can look and see if we see anything. But
I will say, PHA is planning to have at the kind of towards the beginning of the new year a pretty thorough document that's going to give just like some educational information on the Inflation Reduction Act and exactly what changes it's going to make, because there are definitely some, honestly, some pretty positive sounding changes from that law that we're really looking forward to. So some of it is going to depend on how the application of the law pans out, and that is still in the works with Congress. But overall, yeah, good positive changes. And
yeah, for sure. I mean, I think it's going to be wonderful when it does come through. It's just a matter of, I don't want to speculate and say, oh, it's going to be this much or that much, because like you said, we don't know how they're going to apply it yet. So let's just keep our eyes open for it and see what happens. But that's wonderful.
Yep, definitely. Okay, so I think there's a couple more questions. Just quickly from Gisela, this came in. She's asking, how do I know my medicine is in the formulary or is covered?
You just really just need to talk to your insurance company.
And Danielle, I think your sound is a little bit low again, if you're able to get closer.
Again, it's a formulary. You just need to call your insurance company and ask them if it is on formulary. That's going to be the best way to look for it. Also, you can go online to your insurance company and see if they have a formulary list, and that's the best way for you to look for it, to see if it's on there or not. I know some drugs like the Tyvaso DPI is not on formulary for everybody yet because it just launched in the beginning of the year, but anything else, all of our PH drugs, you'll be able to find them if they're on formulary by going to your insurance website and looking up drug formulary.
Oh, and I guess one other question I wanted just to confirm and to read aloud for everyone. A little bit ago, Ruth had asked, is Remodulin with pumps still going to be covered under Part B? And I had just typed out my answer to her that yes, it will be.
Yes.
Okay,
Yes.
perfect.
Yeah.
All right, so we'll go ahead and move on to the next section, and folks can still keep sending us all these great questions. I really appreciate the engagement from everybody.
Very much. Thank you, everybody, so much for the questions. They're great. So switching gears here, we're going to talk about some items that we as providers really would like for you to know. First thing we want you to know is we have nothing to do with which specialty pharmacy you can use and what drug you can get. This is all mandated by the insurance company. And I can tell you, any doctor that's listening to this webinar can say, absolutely. They get very frustrated when they want to put a person on a specific drug for a specific reason, and they're mandated by the insurance company to say, no, we can't do that one yet. However, that we just want you to be aware of this. This is not us. It is mandated by the insurance company. Some drugs are what's called limited distribution. Again, we went over that last week, and only a few pharmacies can distribute them. So you might be with one pharmacy that you really, really like, but your drug is limited distribution, so you have to use a second different pharmacy. That's not we can't do anything about it. That's just the distribution that is limited to us by the manufacturer. And some of the generic brand medications can be sent to a retail pharmacy. I really wanted you to know this part too. But most need to go through a specialty pharmacy. Now, there are two other options. One's called GoodRx, and the second is Cost Plus. These are other great options for some of our generic drugs, and you can get them at very significant discounts. You can buy them through their website for Cost Plus, that's specific, or at a retail pharmacy, which is GoodRx. You can use it through there. And what it means, though, is you will pay entirely out of pocket. It will not go through your insurance company, but you're going to get this medication at a significantly discounted price. But it is, just so you know, it is a generic medication, but it is the medication that you are looking for. It's not going to be anything else. You're specifically going to be asking for a pH medication. And you do have to get the prescription sent by your doctor's office. You can't just get them without a prescription. You have to have a prescription from your doctor's office. I'm just going to go over really quickly tips on changing insurance, because obviously this is what we are talking about. I want you to plan ahead. When the open enrollment time comes around, be prepared to decide if you're going to change to another company or policy. Do your homework, which is what we're kind of doing right now. Speak with other patients or reach out to a support group to see what works for others. And if you aren't happy with your current plan, honestly, it's okay to change. Don't feel like you can't change. I know that with the Medigap, it's a little scary because of the underwriting, but if you have an Advantage plan and you don't like it, it's okay to change. And if you are happy with the one that you're with, you don't have to change it. Hey, as long as it fits the needs that you're with, then stay with them as long as it's working for you. Just remember, it is your choice and you must advocate for yourself. So if you do decide to make changes to your insurance plan, please make sure you do the following. First and foremost, I need you to reach out to your specialty pharmacy first. Let them know your new insurance company and your policy number. The sooner you have this information to them, the better it will be for you. Because what they can do is do a benefit investigation to know if they can service you or if they have to switch you to another specialty pharmacy. Also, let your doctor's office know when you have the new information. If like myself, I deal with this all day long, I do the insurance part of it. If I know specifically that this new insurance company is not going to go to the specialty pharmacy, then I can tell you and I can go ahead and do the prior authorization or go ahead and forward your prescription to the new specialty pharmacy. It's also a good idea to request your last refill of the year to be a 60 or a 90-day refill, especially when you know if you're changing your insurance plan. If you are eligible, a multi-month refill can make it less likely to run out of medication in the new year while prior authorizations are getting sorted out. Please note, however, this is very important, that if you have to have any monthly tests done, such as a pregnancy test or LFTs, you cannot get a multi-month refill for that specific drug. If you're on 3 different drugs and only one of them require for you to get a monthly LFT or a pregnancy test, you can't get a 60 or 90 day on that one. but you can get it on the others. Go for it on the other ones. See if the insurance company will cover it for you. That's a really good tip for the end of the year. So drug formularies, as we talked about last week, there can be changes in your drug formulary yearly. But just because your drug was on formulary one year does not mean it will be on formulary the following year. If you get a letter from your insurance company that your drug will not be covered next year, get in touch with your care team as soon as possible and let them know. There's a process that we will have to be doing with a PA, but you can continue to get the drug if you are currently on it. However, it takes time, and it will take time for the insurance company to process the exception, so the sooner you let us know, the better. Now, if it is not possible and you're mandated by your insurance company to try another drug, we will need to switch. However, if it doesn't work or if you feel better on the other one, we can always switch back. Your doctor just needs to document any issues that you are having, and they can then resubmit your PA paperwork and get you on your now non-formulary drug. So just make sure if you don't like what's happening, or if you don't feel well, or if you're not feeling as good, make sure it is noted by the doctor's office so that we can show them documentation that you need to be on the non-formulary drug that you were on last year. And so some tips on the new year. When the new year comes around, all of your PH drugs will need to be approved again. That's regardless. It's always going to be. The beginning of the new year brings on new prioritizations that are now due. If you're in a big center, please know that it may take time for the office to get your drugs approved. Please be patient and know that we are working on yours along with possibly hundreds of others' patients. I want you to reach out to your provider for help. Your care team is a great resource if you let them know what's going on. Firstly, don't ever agree to pay for a larger copayment until you have spoken with your doctor's office. As I said before, there are options. You just need to reach out to your provider's office and find out if there's funding available, or if there is possibly another drug that might be just as appropriate but not as expensive. There are options. You just have to ask. Also, don't argue with your insurance company if an issue comes up. Don't fight with them for a week before you let us know. We are here to assist you with this process. Please reach out to your provider, and ask for help. We have the resources to talk to them and get your issue resolved. And if you are low on drug, or if there is an issue, please don't wait until the last minute to let us know. We need time to work on a problem for you. We will do our best, but if you are out of drug the following day and we are just hearing about a problem, it's going to be very, very difficult for us to provide you with getting the medication. So to end it, Medicare is a slippery slope and nobody knows it all. I just hope that by listening to these past three, presentations, you have learned a little something, and that Jager and I helped in even a little way to make it seem not so scary. I'm now going to turn it over to Jager to moderate the Q&A for the rest of the time that we have left in this webinar. So Jager, back to you. Thank you so much, everybody. I appreciate all of the feedback. Thank you.
Definitely. So yeah, folks, if there's questions, definitely you can still put them in the Q&A. I know we don't have a ton of time left, but just for the little bit that we do have, there was another question from someone saying, I've been using Medicare Advantage, so my medications are covered, but I've heard straight Medicare might actually be better. How do I determine this? Which I think has been kind of the crux of this whole endeavor. But yeah, go ahead, and I guess we can kind of give a little summary of how to try to determine that for each individual.
Yeah, I think, when you go back to a couple of slides that we started, we just kind of went back and forth with the pros and cons of Medicare Advantage to just going through like a Medigap or things like that. I think what you really just need to do is reach out to Medicare, see what's on formulary, go to medicare.gov, do your research, look and see what may be covered, what the percentages of what it's going to be. We've mentioned before it's going to probably be 20% coinsurance, and look and see what the costs are going to be. Call Medicare, speak to somebody, reach out to PHA Association, see if they can help you with any information as to like what the cost might be. I don't think that they can, but Medicare can. So I think just do your research and do your homework. If you can find out, if you know somebody that's on just regular Medicare, ask them what they're paying for that medication. See if you can find somebody that has the same drug as you. Maybe you're on drug A and they're on the same drug. Let's find out, and they have the Medicare plan, just regular A, B, and D. Just find out what they're paying for it, and if it's going to be better for you and the costs are going to weigh out, it's just a matter of cost. Everybody's individual. It's just really what you can afford. And go for it and see what you can find. I mean, I don't know what other, do you have anything to add to that, Jager? Or?
No, I think that really is, unfortunately, I know it's maybe not the answer that everyone wants to hear. I wish that we could give you some more straightforward answers, but it really, unfortunately, comes down to doing that homework. And I know it can be very challenging and time consuming, for anyone to look into insurance. I know I personally, do not enjoy it when I have to research my own insurance stuff. And, especially with folks with PH symptoms like brain fog and stuff, it makes it even more hard. So I think Danielle's recommendation of just reaching out for help, whether that's to your care team, or we had shared some other resources in earlier presentations about like one-on-one kind of the case management stuff from, I believe it was the Patient Advocate Foundation. Their service can be really helpful, and they have the tools and resources to basically sit with you and do that homework with you. That unfortunately PHA doesn't really have the resources to do that for every single person. So we just don't want to give, a like one size fits all type of answer, because that's absolutely not the case. It's really going to come down to each individual's situation.
Yeah. And Jager, wasn't there a SHIP? We talked about SHIP. That was something too that you could kind of talk to somebody. They are trained in Medicare, and they might be able to help you out a little bit. I think it's with every Medicare.
Yes. Yeah. So yeah, SHIP
Yes.
is per state. There's like a federal, an overarching kind of national organization, but it's per state. I believe it stands for like State Health Insurance Plan or something like that. I'm missing something of the acronym, but it's basically, it is a good resource, and they are going to know a little bit more of the specifics of your particular state. So that's another great place to reach out to as well.
Yeah.
And I do see another question here, or I guess more of a comment from Miriam. Many doctors don't accept Medicare Advantage plans, which, yeah, I would say, Miriam, thanks for bringing that up. And we did we got a lot of questions about this last week. So Danielle and I kind of went back and did some more research on it. And yes, I think that's probably one of the biggest differences for folks on whether Medicare Advantage is going to be a good choice or not. So depending on what area you live in and what particular Medicare Advantage plan you're looking at, because each one is going through a private insurance company, you might happen to live in an area where that particular insurance company that is providing the Advantage plan does have, all of your doctors or a lot of your doctors in network, and then maybe that would be a good option for you. But unfortunately, I think for a lot of folks, and especially I think this is the case in more rural areas where providers are kind of spread out more, there's a good chance that quite a few of your doctors will not be on the same network pretty much with any Advantage plan that you look at. So that's one of the big things when you're considering an Advantage plan is probably, one of the first things is just to double check that network and see if your doctors would be a network for it.
Yeah, absolutely. For sure.
And then I got a couple of different questions from folks about if the webinar is going to be recorded and if the PowerPoints are going to be available. So yes, we are recording all of these. They are going to be going up on the website. And I believe earlier in the chat, Sarah was kind enough to share the spot where the recordings have been posted so far. So this one will also go up as well. And when we send out, there'll be kind of basically like a wrap-up email that I'm going to send out to every registrant. So even if someone wasn't able to attend one of these webinars, if you registered for any of them, I'll be sending out a wrap-up just thanking everyone for all the great participation. And we will provide the slides for each of these presentations, so you can just kind of go back at your own pace and look at them. And then in addition, that will also have that, the frequently asked questions document that I had mentioned. And then we'll also make sure to post a link to each of the recordings within that email as well. So yeah, we are at time already. This is a great discussion, and if anyone does have questions, definitely please feel free to email us. You can email me, or you can reach out to PHA Webinars. That email also works. Any questions that y'all have in the meantime, I hope that we're going to have a great discussion, and just welcome all questions. Doesn't have to be Medicare related. Can be in any kind of insurance, open enrollment related questions. We'll get into that next week. And yeah, as we close, I just want to thank Janssen Pharmaceuticals once again for their support of this program. And Miriam is asking for the email address. I'll go ahead and put that in the chat real quick. Okay, so you can send it to insurance@phassociation.org or PHA Webinars. All right. So thank you, everybody. And
Yes,
yeah.
Thanks, everybody. Appreciate it.
We'll see you all next week.
We'll see you next week.